Good afternoon. I'm Joni Simmons for Advanced Health Assessment BSN program at the College of Central Florida. I'm going to be doing an assessment on my patient here. Good afternoon. I'm Joni. I'm going to be your nurse, and I'm going to do a complete neuro assessment, including the 12 cranial nerves, your face, your neck, your breast, and axilla. It should take less than 20 minutes. You need to go to the bathroom before we get started. I'm going to go wash my hands. All right, if you would please tell me your name, where we are,
Matthew Lancashire in Ocala, Florida.
and today's date.
July 26th, 2020.
Okay, if you would stand to your feet and arms by your side, close your eyes, and stand there for 20 seconds about. What I'm looking for is anything outside of a normal sway. You do have a normal sway, but I'm looking for any inability to stay under lack of coordination. It would indicate that you were intoxicated or possibly have a lesion leading to MS, which everything is good. Now, if you would open your eyes and take 5 steps ahead of you, looking for coordination, balance, and 5 steps back. Steady, very good. Now, if you would hold your arms out in front of you and turn it up, I'm looking for any drift or hemiparesis. And that's good. All right, let me sit back down. I'm going to bring over a couple of objects. I'm going to have you hold your hand out. I'm going to touch your hand with either a soft object or a hard object. I will not hurt you. Soft or hard object, and I'll need you to tell me if it is soft or hard, or if and what digit I'm touching.
Okay. Middle finger soft.
Very good.
Pointer finger soft.
Very good.
Big toe hard.
Okay.
Pinky toe soft. Pinky toe hard.
Very good. Okay, now you can keep your eyes closed. I'm going to put an object in your hand, and I need you to identify what the object is.
Set of keys for a door.
Okay. And then I'm going to use a Q-tip, and I'm going to draw a number between 1 and 10 on your hand, and I need you to identify it to me, if you could, what that number is.
Number 3.
Very good. Being able to identify what I'm drawing on your hand is called graphesthesia, and that is the first thing to go with people, that sensation, and being able to identify is the first thing to go with people with arthritis. And you have to have that graphesthesia in order to recognize what object is in your hand, which that's called stereognosis. Okay. Now I'm going to come to your face, and I need you to, if you would, do what I do. Okay, I need you to smile, blow out your cheeks, wrinkle your forehead, and clench your eyes. Good. I'm going to feel your temporal artery. You're symmetrical in tone, and your temporomandibular joint. And open and close. Open and close again. That's slightly asymmetrical. I'm going to have you clench your teeth again. Okay. And clench your teeth again. Good. And the ability to clench your teeth like that is identifies that the motor portion of your 5th cranial nerve, your trigeminal nerve, is normal. But there's a second part to that nerve, that's the sensory portion, so I'm going to use a cotton ball. And have you close your eyes, and I'm going to touch different parts of your face, and I need you to tell me now when you feel it, okay?
Mm-hmm. Now. 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 Now.
Very good. And I didn't say this before, but the ability to make those facial expressions, that was your 7th cranial nerve, which is your facial. Now I'm going to feel your sinuses. This is your frontal sinus. Any tenderness?
Nope.
And your maxillary sinus. Any tenderness?
Nope.
They're both, no, there's no swelling noted. If you have two more sinuses back there, your sphenoid and your ethmoid, but I can't feel them because they're too deep. Okay. Now I'm going to have you close your eyes and occlude off one nostril. I'm going to test your first cranial nerve, your olfactory. I need you to tell me, if you could, what you smell.
Coffee.
Okay, and then if you switch nostrils and tell me what you smell here.
Peppermint.
Very good. So your first cranial nerve, your olfactory nerve, still works.
Mm-hmm.
And if you'll have your mouth open and say ah. Good. And that's your 9th, 10th, and 12th cranial nerve that works if you can do that. That's your glossopharyngeal, your vagus, and your hypoglossal. Those are all normal. We do your eyes, your 3rd cranial nerve, which is your oculomotor. Okay, feel it right here. And I'll have you follow my finger, if you would. I'm looking for any nystagmus or extraocular movements. That seems to be good. So that's your 3rd, 4th, and 6th cranial nerve that I'm testing there. That's your oculomotor, your trochlear, and your abducens. Okay, and those are all good. Since we're on the eyes, I'm going to go ahead and do just a quick eye exam. This takes just a little bit of time. Just test your 2nd cranial nerve, your optic nerve. Okay, and if you would please hold it about 20 inches away from your face. A little bit closer. That looks like that's about 20.
Okay.
And if you could read that line right there for me.
L.
Oh, sorry. I'm gonna hold it. I need you to cover up one eye,
Okay.
just your left eye.
Mhm.
Yeah.
L. O. P. F. Z. Z. D. O. T.
Okay. And then if you would cover up the other eye, and then about 20 inches. That's good right there.
D. Z. E. C. L. P. T. O. F.
Okay. And then we'll do both eyes together.
Me still on it?
Mhm.
Okay. E. L. Z. T. C. O. F. P. D.
Good. Thank you. And it was normal 20/20 vision, but just so you know. All right, I'm going to come behind you and I'm going to test your 8th cranial nerve, which is your acoustic nerve. So if you would cover your right ear with your hand. And I'm going to stand back here and I'm going to say 3 words. I need you to repeat back to me in a normal voice what I'm saying, okay?
3-8-B.
Very good. On the other side.
2-4-D.
Very good. Now I'm going to come from behind you. I'm going to feel on your throat, okay, very gentle. And we'll feel your thyroid. I'm looking for any enlargements or asymmetry. Good. Now if you would fold your head forward into a flexion. Good. I'm checking your range of motion. Your head back to extension and then hyperextend back. And that's good. And then we're going to do a lateral bend, ear to shoulder, one side and then the other. Okay, very good. And then I'll have you turn your head to the sideways this way and push against my hand. Good. And then the other way, the same thing here. Good. And then I'm going to put my hands on your shoulders and I need you to shrug. Do it again. Okay. That's your 11th cranial nerve, your spinal accessory. Okay. While I'm here, I'll do your lymph nodes. This is your supraclavicular. This is your submandibular. It's difficult to feel with your beard. Your submental. Anterior cervical. your posterior cervical, your tonsillar, your pre-auricular, your post-auricular, and your occipital. Very good. Now if you raise your hands and put your arms behind your head, and I will feel lateral, central, subscapular, and your pectoral. Good, and I'll have you lean forward. I'm looking for any asymmetry. Good, you can lean back. I'm looking for any asymmetry or any masses or irregularities. And right here, and you can put your arms down. Right here in the talus fence is where most breast cancer occurs. I know that breast cancer, I should let you know that breast cancer in men only happens in about 1% of the cases, but it does happen. Okay, and what you can do a self breast exam in the shower when everything's nice and warm. You can feel the areas up there and across, you know, and up and down a circular motion. And the what you would look for is a mass that's fixed to one area, that's hard but not tender. And they're very irregular shaped. Okay. Some risk factors that would, you know, predispose somebody to breast cancer would be having a first-degree relative that has breast cancer, or over the age of 65, being tall. Tall people tend to be more prone to it, obese, or alcohol use. Okay. Any questions?
No.
Okay. Thank you for your time, and thank you.